Hi everyone, it's Lyndsey and Tom, and today we're going to be talking about gout. So first of all, what is it? So essentially it's a form of inflammatory arthritis, and it comes about when there's too much uric acid in your blood. It is very natural in the blood, and it comes about when we break down and recycle purines in our food, and it also comes from body tissues. Usually this is passed out by the kidneys, but when we have high levels, it can't always produce all this down. So high levels of uric acid do not always cause gout, but basically when we have these high levels, it leads to crystals forming in the joint, and this can trigger an attack of gout. So things like swelling, heat and redness in the joints. So during an attack, it can be so painful that even the lightest touch, such as bedclothes, can be unbearable. So some people might only have 1 or 2 attacks of gout, and then will never get it again. But if the gout does continue, it can kind of cause more damage, and the joints can start to become damaged. So you can get it. So again, it's more common in men and older women. Common factors such as running in the families. You've then kind of got your lifestyle things such as high cholesterol, if you're overweight, drinking too much alcohol, especially beer, and more usually by eating a lot of food. And then it can also be caused by other kind of health conditions. So if you're on blood pressure medication, or with women after they've been through the menopause. So what are the symptoms? So kind of pretty commonly they come on overnight, and you can kind of expect things such as severe attacks of pain, feeling really hot, swelling, and then redness of the joints. So it often affects joints such as the ankles and the feet, and particularly the big toe is a common area. But it can also affect areas such as knees, wrists, elbows, so anywhere that you've got a joint really. And they can last kind of from a few hours up to kind of days or weeks. And it really depends on kind of what action you take as a result of this. So like I said, the big toe is a really common area, and these areas are quite easy to diagnose. But where you kind of have other joints, it can be kind of misconstrued through things such as arthritis, and the kind of diagnosis of gout can be missed. So if you are in kind of any doubt, then please speak to your kind of GP, or you can get referred to an expert who can look into this more and figure out if it is gout or if it is arthritis. So how do you get diagnosed properly, Tom?
Thanks, Lyndsey. Yeah, so one of the main way, to get a diagnosis is where they take a sample of that crystal from the uric acid in the joint, and they essentially put it under a microscope and they have a little look at it. It's easy for somebody to obviously, who's trained to do this and get a sample, but sometimes when you've got a really swollen ankle or a knee joint, it's really quite tricky to sometimes, or even impossible to sometimes actually get a sample of that. So it is quite easy for a doctor to assume diagnosis through gout, that it is gout, from quite simply assessing the area, and sort of just making an educated decision on that. But during obviously a gout attack, those uric levels in the blood, as you mentioned, can often be low or normal. So checking the levels during an attack is not the best way to check it. So if you've got an infected area, if it's swollen, if it's jumped up, then usually if you go speak to your GP, they're going to just say it probably is gout because of the signs and the symptoms. But in order to test it completely, you would need to not be in an attack, where the doctor can test the crystals within the uric acid from the joint and then take it from there.
So once you've been diagnosed, what are the treatment options available?
So most sort of common treatments are with the use of anti-inflammatory medicine, like ibuprofen, things like that. But if you do have frequent attacks, or your levels of uric acid in your blood are very high, you may need to reduce those uric acid levels through medicine. Raising the limb above the heart. So this is quite common, usually to reduce swelling. It just sort of it aids the blood flow from that affected area back down to the heart, so it can remove all those toxins and metabolites from that area and really kind of reduce that swelling. Keeping it cool, so an ice pack again will do the same thing. It will cause the vessels in those certain areas that are affected to what we call vasoconstrict. So they'll tighten up and they'll send all the blood all the way up to the heart again for that same process to happen. The drinking lots of water again can help this process by decreasing the viscosity of the blood, so it makes the blood nice and runny and thin, and essentially allows that blood to flow a lot easier from that affected area back up to the heart. Trying to keep bedclothes off of the affected area or the joint at night, and trying obviously not to knock the joint or putting pressure on it. Making sure you're not wearing too tight trousers or anything like that that's going to put too much pressure on that area. More treatments here as well. If you do have persistent high uric acid levels, and it's more of a long-term, it can cause long-term problems, kidney problems, high blood pressure, cardiovascular diseases such as strokes and heart attacks. So that's when the treatments options are mainly going to be those medicines that do reduce the uric acid levels in the blood. So higher uric acid levels, of course, in long term can lead to those collections of the uric acid in soft tissues, and the fingers, tendons, cartilages, and really aren't going to be very good for your body, and it can cause a lot more pain and be very difficult to manage if you let it go on.
So if this is something that you kind of suffer from regularly, how can you prevent these attacks from happening?
Yeah, so some really easy ways that you can reduce or prevent these attacks from happening, such as reducing your alcohol intake, especially beer, they say. Avoiding sugar, any sweetened or fructose, which is essentially just fruit sugars containing in drink, and any forms of smoking, try to reduce as well. Increase your intake of fruit and vegetables, especially those containing vitamin C. Avoiding high purine foods, such as yeast, so breads, things like that, and obviously not too much red meat. Avoiding or following generally a diet which is high in fibre, and drinking cherry extract as well has been known in research to reduce or prevent attacks.
So we should really be looking at trying to not consume certain things, but as a minimum, we should be cutting back on certain things.
Yeah, absolutely. So yeah, red meat, as we said, sugary drinks, fatty foods, and trying not to really drink more than 14 units of alcohol per week. And then, as I said, I'll highlight again, especially with beer.
So if we make certain lifestyle changes, it means that we might be able to reduce or stop further attacks?
Absolutely. So maintaining a healthy weight, avoiding those crash diets are really going to help. Keeping a healthy, balanced, and active, of course, diet and lifestyle with plenty of vegetables and some slow fat dairy foods. Obviously, again, reducing that alcohol, especially the beer, plenty of fluids, water, making sure you're hydrated and you've got really nice blood flow, circulation around the body. Exercise, as we mentioned, and stopping smoking, as we mentioned as well.
And I've heard about some complications with gout, such as chronic gout.
Yeah, absolutely. So it is rare to get lots of these attacks, but if you do, obviously it can develop permanent damage, which essentially is a chronic gout. And obviously chronic gout is obviously there's tiny little lumps, white lumps called tophi, that appear under your skin, especially under your ears or in your ears, and fingers and elbows as well. So these are where the urate crystals really kind of form under the skin, and they can be really, really painful, really to the touch. They can be hot, etc. And as we mentioned before, even like a bed duvet bedding can really kind of affect that area. But you get those kidney stones, if your uric acid levels are very high, so you definitely need to treat to reduce those levels. You really don't want kidney stones, and having known people who do suffer from kidney stones, is really, really not what you want to get. It's really quite painful. So following these precautions is really, really easy to do. Obviously, there's help wherever you need to go. There's lots of information on the NHS websites. We're here for you guys to speak to if you ever want us to push you onto the right places, to direct you to the right places. We're happy to do so, but really trying to prevent this and manage it as well. If you do suffer from gout, definitely take a little sort of read through this presentation properly, and should hopefully help you.